Let's talk about parts work. So, you might have heard the term parts, working with parts. What does that even mean? If you're new to my channel, my name is Tracy. I'm a licensed clinical psychotherapist in private practice, and I mainly focus on trauma, complex PTSD, dissociation, anxiety, and depression. So, let's describe what parts work is. We all, as humans, have parts. And I'm going to give you an example. So this is a very simple example. So let's say there's a part of me that wants to go to the gym. And going to the gym can be a health benefit. It can help with self-esteem. It can help with calming that nervous system, getting some pent-up energy out. Maybe it's when I release a lot of energy at the gym, I can sleep better at night. It can help bring cholesterol down. So lots of health benefits. So that's a part of me that maybe feels the desire to go. But there might be another part of me that's feeling like, oh, it's work, it's discipline, it's boring to go to the gym. I really don't feel like going. I really don't have the energy to go. So I have conflicting feelings about the same topic. And so in therapy, what we do is the therapist will work with the client to facilitate a dialogue in the client's mind to discuss with the parts. And what that can do is you can clear out barriers, you can get clarity, you can sit in the emotional charge for the part of that person that doesn't want to go to the gym and have a felt experience about that. Maybe it kicks up prior experiences that feel familiar to this current block. So that's an example of parts work. So I use ego state therapy. There's also IFS by Dick Schwartz, which is it's a very common treatment modality. That one's very expensive, and I heard it's really hard to get into. And ego state therapy is a bit more affordable to get trained in, and it essentially does the same type of job. The lingo and language is different. With IFS, they talk about exiles and managers. We have the same in ego state. It's just the language is different. So there are other ways that ego state therapy is used as well. And this is for the folks who have dissociative disorders, specifically the complex dissociative disorders. So OSDD, which is other specified dissociative disorder, and dissociative identity disorder, formerly known as multiple personalities. And there are assessments that therapists can use to figure out how much complex PTSD a client is holding. And in doing those assessments, we can figure out that if we need to do parts work. So for example, somebody with dissociative identity disorder, for those of you who don't know, you have to have at least one other alter in the system that can take control of the physical body and interact with the outside world, and also have a really strong influence in the physical body. There's a lot of things they can do, but that's a topic for another day. But this video is about how do we work with the parts. So parts or alters, and sometimes there's different terminology, but essentially those are the two main terms, parts and the alters. So what we do is we use a technique called Fraser's dissociative table, where in the client's mind, we have them imagine a meeting space with a conference room and chairs around the table. We try to make it as comfortable in that meeting space in their mind. So having a door with windows, maybe flowers, or whatever it is that can help that client and the alter that comes into that space to feel comfortable. And what we do in that space is we facilitate a dialogue. There's so many things that we can do. Reorienting parts to the present, right? Letting them know, We're in 2026. We can ask, what year did you think we were in currently? 9 out of 10 times, it's a year when they were growing up, 1975, 1982. So we reorienting parts to the present. We help to explain what's different in the present day than what was happening back in the day when the trauma was happening. That's, of course, assuming that the trauma is past. Unfortunately, lots of clients are still in relationships that are traumatic and abusive. So we would facilitate different kinds of conversations around that piece. But it's what we do with the parts is we get to know the parts. Parts are often traumatized. They are often stuck in trauma time. And we work with the ego states because parts hold specific memories and the knowledge and the emotions and the pain. More importantly, the pain that part is holding. So we can learn to lift the burdens of the part by using interventions and all kinds of cool techniques. So parts work there's so many ways to use it. It is really, really powerful and it is really therapeutic. It does tend to seep deep into the subconscious, and that's a privilege to be able to work with the client. And you have to build up trust and rapport with that client to be able to access and work with what's essentially going on underneath the hood and in the physical body. So the main purpose is to heal parts, to reorient them to the present, to lift the burdens, provide psychoeducation. It is not uncommon. Parts carry lots and lots of core beliefs about themselves, such as I'm not good enough, I'm powerless, I'm unworthy, and on and on and on and on and on. Another extension of doing parts work is a pretty cool treatment modality called the DNMS, which just stands for the Developmental Needs Meeting Strategy. So an example of how we would use that in parts work would be to have, once we've done the foundational work with the client and they're, feeling safe enough to go deeper, we can use the client's highest, wise, healthiest self, for example, to, in a sense, reparent that wounded inner child that's like stuck in trauma time. So what is it that part did not get when they were growing up? Was it a sense of love, for example? And so we just have the client provide that in a way, in the inner world, working with that part or in the mind to meet that child's needs. Because think of it as like a kaleidoscope. They say like the past is never really past. It bleeds into the present. And either you've had good experiences in the past, which help you to be resilient and strong and all those traits and skills to help you get through life successfully. But when you have a history of trauma, parts are wounded. So we can, again, it doesn't matter what age the part is or what felt age that part is resonating with. We can do a corrective experience and we can teach the clients to do that, which is really cool. Somebody, I forget which trainer it was. I've had so many trainers and stuff like that and consultations with providers, but it's parts work is like the spa for the inner child. You might go into the spa when you go to get a massage and you're like sore and you're hurting and tender and all this and that. And then when you walk out, it's, hopefully in what it's designed is to feel like a breath of fresh air, feeling grounded, feeling embodied, feeling just good, really good. That is what parts work is like for the inner child. So I hope this clarifies for folks who have heard about parts work, but they're not really sure what it consists of, if they would even need or want to do that, to do this kind of therapy. It is really powerful. It is really cool, and I highly recommend it. We all can use it from time to time. I hope you like the video, and I will see you next time.